Today I want to talk to you about staying healthy, and that applies to people apparently from 15 to 90. And what does staying healthy have to do with your eyes? Well, when we look through your eyes, we can tell a lot about your health. As a matter of fact, we can detect hardening the arteries, evidence of future strokes and heart attacks. Would you expect that in a 15-year-old? Well, neither did I until recently. 20-year-old? Well, I saw that a couple of years ago. What is it that I saw? Hardening the arteries. This is an epidemic in America. I'm going to guess that approximately 1 out of 3 people coming in my office have probably an issue with this. The U.S. Department of Health is predicting that 30% of the people in America will be diabetic in the next 20 years if they don't change what they're doing. I'm seeing that every single day when I do photography of the retina, digital retinal imaging. By the way, this is not what's called OPTOS, which takes a red-green image and does not give good detail. This is what's called digital retinal imaging. Gives a high-resolution picture of the back of your eye and allows us to tell a lot about your health. What's the importance? Well, I had a gentleman here a few years ago who was 100 pounds overweight. He has young children. I told him and showed him what was wrong with his eyes and what his risks were. He lost 100 pounds in a year. It was one of my exceptionally proud achievements. I was proud of him, that is. And he no longer has hardening the arteries, and he'll be around to see his family. I saw a 15-year-old boy very recently. He was a football player. Looked fantastic, muscular, tall, strong-looking. He had most severe hardening the arteries I've seen in people in their 40s or 50s at his age. What did he eat? A diet of junk food. Name the white substance, it's something he consumes, unless it's soda, candy, or cookies. Well, there's something to learn here. Learn that reducing your carbs, taking omega-3 oils, having a flat stomach means you will stay healthier. Your risk of diabetes, strokes, and heart attacks is less. We see this all the time through digital retinal photography, which is an optional holistic health test in my office that helps detect disease and helps you stay healthy. So the next time you go to your doctor, ask them to do a digital retinal photograph of your eye and tell you how you're doing. Let them look at your blood vessels. When I was a student, before we had many of the wonderful technologies we have today, that was looking in the eye was called the single most informative test other than an autopsy, which is not a good thing to have, by the way, because it doesn't say you're in good shape at that point. So it doesn't mean much less today, except we don't have to do a simple exam with a handheld instrument. We can look at your eye with a camera and learn tons more in just seconds. So if you're at my office, get the digital retinal photography. It may just save your life and your family's future. If you're at your doctor's office, ask them to do a digital retinal photography for you. They have a camera. If they don't have a camera, you shouldn't be in their office. Happy holidays and stay healthy.